see that there are some ways that they're mutually reinforced. And that brings us to our next assumption that, yes, we do have overlaps in these various perspectives, and that strong organizations are able to not only work at the individual level, but also at the community level, and that strong organizations have thought about how they're doing their work, so they have a framework or they have an approach to how they are working in their organization. Okay, having a little trouble with my clicker here. And this probably is the most compelling reason for moving toward prevention and for how we really think about our work together. So in the world that we're working in, sometimes we hear the word transformative used. And that's a big word, and it's a word that I don't use very frequently. It's not to be taken lightly. But when you take a look at population attributable risk, it makes a very compelling case for prevention. And population attributable risk essentially means that if you, in this slide, it means generally that if you could take away something, these would be the results. And in this case, we're looking at if you could take away exposure to ACEs, the adverse childhood experiences, if you could remove that entirely out of our society, these are the benefits or the results, the outcomes, whatever you want to call them, that we would see. A 33% reduction in separation and divorce, a 41% reduction in chronic depression, a 43% reduction in an inability to do activities due to health disabilities, a 48% decrease in promiscuity, a 52% decrease in intimate partner violence, a 54% decrease in high use of painkillers, and we all know that we're facing many issues around opiate use right now in our country, a 61% decrease in drinking-caused problems, and a 61% decrease in incarceration, a 65% decrease in alcoholism, and a 69% decrease in serious persistent mental illness. So, as we keep building resiliency and we keep working on preventing toxic stress, think about the different world that we would be living in if this was actually our reality. So when I look upon this, it's very motivational for me, it's inspiring for me, and it enables me to use the word transformative, because this would be nothing short of transformative. Even if we're just making progress on this road, this is a remarkable difference in the way that our culture and our society would function if we could just remove ACEs. That's a tall order, and so, you know, that's why all of us are needed to join in the effort. So I want to turn it over to Angela, and she's got a PowerPoint that she's going to share with us on the Family First legislation, and then we'll also have some time afterwards for you to be able to ask Angela some questions. And the way the questions work, because we've got 5 different sites, is that you talk to your group and ask your group what one question you might like to ask Angela after you've had a chance to hear her presentation. It's not mandatory that you ask a question, but if you would like to, get consensus from your group on what question you would like to ask, and then we'll go remote site by remote site, and we'll have that question so that Angela can respond. So Angela, thank you ever so much for being with us once again. We turn the time over to you.
Thank you so much, Susan. Can you guys hear me okay? Am I coming through? I want to thank all of Strategies 2.0 for their technical assistance. It's amazing the way we can all come remotely together and yet be unified through technology. And so I'm really grateful to Strategies for putting this together today. I think I will jump in. As Susan stated, I was presenting to a statewide Strategies 2.0 staff meeting, and I'm feeling very excited about prevention and the direction of prevention at this point in time. I think it's a critical point in time for prevention to really be elevated to the degree that I would like to see it elevated. So I'm very excited, very passionate about what's going on in the state as well as at the federal level around prevention. And that's really what I want to present on today. So if you guys could switch me to my slides. Are you guys there? Can we have the OCAP slide deck?
There we go.
Low connection on her end.
Can you hear us, Angela?
Yes, I can.
Awesome. We're back.
All right.
Okay. It looks like from what I can see that everyone was hearing me. I just need my slide deck.
Can you see the slides, Angela?
I can. So as I was stating, basically I'm giving you today an overview of what I see from the state perspective on what's happening in the realm of prevention services for children and families. So let's proceed to the next slide, please. Okay, I thought I would just give you a brief overview of the Office of Child Abuse Prevention. Our vision is that no child suffers from abuse or neglect. Our mission is to shape policy, build communities, and strengthen families so that child maltreatment is prevented. And our objective is to lift, link, and leverage. And, Strategies 2.0 is really a critical partner in that effort of lifting our partners through training, linking one another through these learning communities, and then in many ways we try to leverage resources and funding with our partnering organizations. And so, that is what we are doing here at OCAP. Next slide. We receive in OCAP approximately $90 million in funding each year. At the federal level, we receive monies from Child Abuse Prevention Treatment Act, or CAPTA. We receive community-based child abuse prevention monies, or CDCAP, and we receive Promoting Safe and Stable Families, PSSF funding from the feds. The majority of that funding goes out through an allocation process, but it also goes out in grants and contracts. Only about 10% of the monies that we receive goes out in grants and contracts. Also at the state level, we have child abuse prevention, intervention, and treatment funding, which is CAPIT. That was realigned to the counties when we had realignment in around 2010, 2011. And so basically the counties agreed that whatever their level of CAPIT was at that point in time of realignment, that they would continue spending on prevention, intervention, and treatment at that same level. So we try to hold them accountable for that CAPIT funding to continue. And then we have state children's trust fund monies that we receive monies from kids plate, license plate sales. We receive it from birth certificate fees and donations. And so that's what makes up our SCTF funds. Currently, OCAP is we've issued about 37 grants and contracts, and I expect that soon we're going to be at 50 grants and contracts. So I just want to make it clear, when I started here in OCAP 4 years ago, I think we had at maximum 5 grants, and we are now at 50 grants. And I would say that, you know, we're just doing everything that we can, that as quickly as we receive money, we're trying to put it out there on the street and get you guys funded for the work that you are doing, and really just make sure that prevention is as healthy as we can possibly make it. Next slide. So I want to just share with you that at the federal level, we really have an advocate that is working on behalf of prevention, in the fact that Jerry Milner is the Associate Commissioner of the Children's Bureau and the Acting Commissioner for the Administration on Children, Youth, and Families. And Jerry Milner has been going around the nation and really blowing the horn of prevention and really advocating that child welfare change the way that it does business, and that we work harder to try to keep children and families together, and that we do more for strengthening families with services and supports, and not removing children whenever possible. He's working this at various levels. In July, he brought together all 50 states and asked each of the 50 states to bring together a state team. Each state produces a 5-year children and family services plan, and he was basically asking the state teams to think about how are we going to incorporate prevention into our children and family service plan that will be due in the next, I think it's due next year, sometime next year. But the July meeting was really just to get us to start shifting that focus and thinking more about prevention. And so I have heard him speak now at, probably 4 or 5 locations already. He's really on the road quite frequently. Today I received an article that he wrote, and it was really about moving our judicial system and trying to get the judicial system to really consider how we can keep children and families intact more often and provide those families with supports and services. So I really see a tremendous movement at the federal level, although I am not seeing more money just yet for primary prevention. So I'm hoping that is to come, but not yet. So next slide. So what is on the horizon is the Families First Prevention Services Act. And as many of you may know, this bill, if you will, was tried through Orrin Hatch, Senator Orrin Hatch. They tried to pass this legislation, and California was actually one of the states that was really opposed to the legislation getting passed. And the reason for that was California was receiving monies through the Title IV waiver and other funding sources, and And so California felt that if we moved in this direction of FFPSA at that time, in the way it was written at that time, that California would end up losing money. So it did not pass when it was originally proposed, but then in 2018, it was changed, and then it was slipped into the Bipartisan Budget Act. So it does contain new preventative service options and requirements for foster care placement. It amends existing provisions within Title IV-B and Title IV-E of the Social Security Act, and it authorizes several existing programs through 2021. So what I want to say about Families First Prevention Services Act, I'm going to call it FFPSA, it is under consideration at this time. We are having partners review it. OCAP did a webinar and invited all of our partners to listen in about to that webinar and provide any comments or input. And then we are working with the County Welfare Directors Association, asking them to review this legislation, asking for their input and how this will impact them. We're also working with probation officers, asking them to look at the legislation, getting their input, as well as advocates. So we're really trying right now, we're in the process of analyzing this legislation, getting input from various advocates and stakeholders, and really trying to articulate the impact that this is going to have on California should we opt in to FFPSA. I do want to explain that this is an opt-in situation, so every state has an opportunity to opt in to the legislation. We as a state are not going to decide on whether to opt in or not until we have a new governor in place. And as many of you may know, Will Lightbourne, who is the director of the Department of Social Services, will also be departing possibly the end of December and January is what I've heard. And we expect we will have a new director in the Department of Social Services. So we have new leadership that's taking place here at the state. And before we make any decisions about FFPSA, we need to get our new leadership on board and have our new leadership buy into this legislation if we move in this direction. And my understanding is I believe we have at least until September 30th of next year before we have to make a decision about whether we will opt into this legislation as a state. If we could go to the next slide, please. So just so you know, this legislation is broken into 8 parts. Part 1 talks about prevention activities. Part 2, enhanced support under Title IV-B. Part 3, licensing standards for relative foster family homes. Part 4 is ensuring necessity of non-foster family home placement. Next slide. Part 5, continuing support for children and family services. Part 6, incentives for promoting adoption and legal guardianship. Part 7, developmental needs of all vulnerable children under age 5. And Part 8, delays the phase out of the delink of aid to families. So there's 8 parts. Basically, we have to opt into, I believe it's Part 8, in order to have Part 1, which is prevention services. So it's not just prevention that we're having to concern ourselves with. We have to concern ourselves with every single part of this legislation. And to adopt one part means we're going to be adopting other parts. Part of this legislation really has to do with what we've been working on in California, which is continuum of care reform. I feel like California is somewhat ahead of the game because we have been working to keep children in nurturing home environments and getting them out of group home type of facilities. So we have, as a state, been working hard towards that end. That is part of this legislation. And my understanding is many other states are not as far along in that process as what California is. And so I think that we may be positioned a little bit better in that regard to be able to opt into this legislation. Next slide, please. So one of the concerns, wait. Let me see here. I basically told you about the Bipartisan Budget Act of 2018 and how Families First Prevention Act was part of Subtitle A, Investing in Prevention and Supporting Families. And just basically that what we see in our analysis thus far of this legislation is that it would not support primary prevention, but it might support secondary prevention. So that would be our differential response families that need support. Or it could be another definition of families that we are going to try to keep together, but that are not going to come into the system, or we're going to try to prevent from coming into the foster care system. We can go to the next slide, please. The big thing, well, there's many things about this legislation that needs further definition. And one is we need to define who is a candidate for foster care. So what is going to be the imminent risk of a child entering into the foster care system? How are we going to define that so that services can be directed towards that child and family? So that's something that we're going to have to make sure that we as a state are very clear about who is a candidate for the prevention services offered through FFPSA. And then also, in order for that family to receive services, it must be stated in advance in a prevention plan. And this is, again, secondary and tertiary prevention versus primary prevention. So it's going to, if we adopt this, there is going to be a change in how we're doing child welfare, particularly for those families that may be on the edge of coming into the child welfare system. We may have to not be as quick to remove and be much more supportive in trying to keep those families together. So, and the thought is that maybe if we move some monies, if we're able to use some of these dollars for secondary prevention, maybe more primary prevention dollars could be freed as well. So it is an opportunity for prevention, but we have to make sure that we can do all the components of this legislation in order for it to work for us. Please go forward. So it's also specified in this legislation that programs must be evidence-based and trauma-informed and include a strong evaluation strategy. So we are working, the CEBC, California Evidence-Based Clearinghouse, is actually working very closely with the federal government right now to define what is going to be funded through FFPSA. And we're really not clear on that. We have done a survey basically of services that are provided throughout the state. And I guess the bottom line is there are services that we provide like wraparound, which would not be considered necessarily an evidence-based practice or have a strong rating on CEBC, but yet it is a common practice that we would want to continue. So we have to really negotiate with the federal government right now about what kind of services and supports that we are going to be able to provide families and what's going to fit into their definition of being evidence-based and trauma-informed. So that is another part to us, whether we adopt this or not. So supposedly the secretary was supposed to provide us with a pre-approved, non-exhaustive list of services and programs that were approved by the federal government. That did not occur in October 2018 as expected. And so I'm not exactly sure when we will get that information from the feds, but there is work that's being done around this very subject. Go forward, please. So I talked about earlier, differential response path 2, model of service prevention might be a possible use for these funds. So it would be families with a moderate level of risk, although, you know, again, the definition that's being used in FFPSA legislation is imminent risk of entering into the child welfare system. It might be used for pre-family maintenance or families with informal supervision. And child welfare social worker would hold the case and ensure that the families are connected appropriately with services provided by community-based organizations and other prevention partners. It could increase family maintenance programs, and that may involve both court and voluntary family maintenance. Next slide, please. So I just want to wrap up the FFPSA before I jump into the state's movement towards prevention and just say that I think that this has possibilities, but we are still analyzing it, and we as a state have not made a decision about whether we're opting in or not. It is exciting to me that it has an opportunity to possibly shift some funding more towards secondary prevention. You know, as a person who's worked in the child welfare field, who has removed children from homes, I know firsthand the trauma that's associated with the removal of children. And that is partly why I'm so passionate about prevention, is because no matter how bad homes were, children wanted to be in their homes in 9 out of 10 cases. And I do believe that we could spend more money in the area of prevention and keeping families together in order to not remove children and not put children through that trauma. And so it is my hope and my passion that we have more flexible dollars that come available for that purpose, that children are kept safe in their homes, families are provided with necessary supports and services, and that really we are helping both children and families become the best that they can be. And so, so it is exciting that there is some legislation on the table that could provide us with a little bit more flexible dollars towards prevention. But again, a decision by the state will not be made until it's been fully analyzed and we have full input from stakeholders and constituents and everyone that is related to this legislation. And if you have any comments, concerns, input to this legislation, I invite you to read it, and I encourage you to send it our way in OCAP and let us know what those thoughts and concerns are. This is the time for us to really evaluate it and understand what the ramifications will be. So moving on, we've talked about the federal level, that there's movement, and there's also movement towards prevention at the state level. CalWORKS, as many of you know, has received funding for home visiting. And that's really an exciting thing, because families that are not associated with the child welfare system but who are in the CalWORKS program are going to have an opportunity to receive parenting services, parenting education and services, and hopefully strengthen those families. we do see a lot of crossover with our child welfare system and CalWorks and other programs that are offered by the state. And so to the degree that we can connect with these families that may be at risk and offer them supportive services, we think that we will be strengthening families and keeping children out of the home, out of the system. Home visiting tends to be a very effective model in general. I mean, even though we have to look at which model is being funded, I think that meeting families in the home and their comfort level tends to be more effective. Now, with regard to the CalWorks program, organizations and counties, the monies that were initially set aside for this home visiting program, it really was intended to expand current home visiting efforts, because to start up a program, oftentimes it takes like a year to get positioned to be able to administer it. And the idea was they wanted to hit the ground running with home visiting, and so they were looking for how can we expand home visiting and really give it to people that are at risk and are vulnerable. And there's a lot of resources available through CalWorks. So we think that that is a prevention strategy. It's not out of OCAP, but it is out of the Department of Social Services. And I think that it's a really positive move for prevention. Of greatest excitement right now to OCAP is that the County Welfare Directors Association, they brought in a guest speaker in January, and this was initiated by the head of the Directors Association, Frank Mecca, whose picture I have on the slide. My slides got a little messed up, I see, in the transition from my computer to this computer, but that is Frank Mecca, and he really asked the question of, like, integrated core practice model, where is prevention in there? And so he was very interested in really elevating prevention, and this was his initiation. And so the County Welfare Directors Association brought in a guest speaker on their own dime to come and speak to them about prevention at a Children's Committee meeting here at CDSS in January of 2018. And they brought in Dr. Robin Jenkins, who was with the University of North Carolina, and Dr. Jenkins really challenged the Children's Committee and said, whose responsibility is prevention? And honestly, most of the child welfare directors kind of didn't want to take ownership, let's say it that way. They felt like it was a shared responsibility, and indeed it is a shared responsibility, but Robin Jenkins really challenged them to take the lead in that we need leadership to move in the direction of prevention. And so from that presentation, a prevention cabinet was formed, and this prevention cabinet is made up of about, 8 to 10 counties are represented at the table, and they've been meeting monthly. They have invited me to be a part of that cabinet, and every month they are talking about how do we elevate prevention across the state. And one of the things that they really wanted to do was to organize a prevention summit. And they wanted to host 2 days where we would bring together county teams of up to 10 people and have it be an interagency team, and have those teams sit down at tables, hear presentations, but also begin prevention planning. So for some counties, it may be an expansion of prevention planning where they're doing more of a focus on prevention. And for some counties, it may be literally from the ground up, starting a prevention plan that has not been in place. So that was the idea of the prevention cabinet. And with that, I suggested, well, Strategies 2.0 is funded to host a convening. How about if we leverage that convening for this purpose? And then I also contacted the California Evidence-Based Clearinghouse, Rady's Children's Hospital, and they have graciously given us space at the Child Maltreatment Conference in San Diego. We will have a room with capacity of 250 people, and it'll be for 2 days on January 31st and February 1st. Now, the letter was just approved last week, and it started distribution. I don't know how widely it's been distributed at this point. Quite honestly, I think OCAP has not formally sent it out. We've sent it to our liaisons and some people, but we need to send it out in a newsletter, and I don't think that that's been finalized. The County Welfare Directors Association is going to send it out to their mailing list of county welfare directors, and then we're also going to send it out. I think I saw today that CFRA, the California Family Resource Association, sent the information out today. So it's getting distributed. The thought is that there's an application process for attending the summit. It must be attended, the leaders of that team must be the child welfare director and the CAPC director. So together they must identify the team to come to the summit. And we have recommended within the letter who should be invited to the summit, including First Five partners, Family Resource Center partners, Department of Education, possibly your mental health partners, behavioral health. So a variety of partners could make up the team, and all of which may be working in the prevention realm, but we all have to come together and understand what are we doing in our counties as it's prevention related, and then where are the gaps. And we're asking the teams to meet prior to the January 31st summit and review their data for their county and get prepared for the summit that will take place. So this is very exciting. We haven't seen this kind of initiative and movement come out of child welfare in times past. And quite honestly, my staff have often complained that it's hard to get child welfare's attention on prevention simply because they are often so crisis-oriented. They're dealing with the fires, and they really don't have enough time, energy, or motivation sometimes to focus on prevention. And so it's really exciting to me to see that the county child welfare directors have initiated this, that they realize that they need to focus on prevention. The 10 counties that are part of the cabinet, they are all prevention enthusiasts. Many of them have already begun prevention planning in their counties and are already having success with prevention and want to share and motivate their peers to move in this direction of greater prevention. It's very invigorating to me to be a part of this cabinet and hear the counties talk about prevention so highly and have such enthusiasm around it. So I think it's a really exciting time that we're seeing, and a pivotal moment. What I was stressing that Susan heard me say at the Strategies Leadership meeting was, this is a moment that we can't let pass by. This doesn't happen every day. And so we really have to be team players. We have to bring value. Each of us that are going to be involved in this summit have to bring value to the table and have to really work collaboratively and effectively in order for this to go forward. We also foresee that that we not only have to do a big lift to get everybody there, but we're going to have to do a big lift after everybody is there with continued technical assistance and help for just ensuring that this beginning of prevention planning continues to move forward. So we at OCAP, as well as Strategies 2.0, are going to be on standby for how are we going to assist and really ensure that this moment doesn't drop after a summit, but that it continues and that we literally see a movement across this state towards greater and greater prevention efforts. So we're very excited about this, and we are looking forward to the challenge. Next slide. So I guess I have talked enough. And now I just want to open it up for questions and comments, and I'll do my best to answer those.
You can type comments into the into the chat, and I can read them out here, or if you type that you want to speak and ask your question, I can ask you.
We'll go remote site by remote site.
Thank you so much, Angela. I just appreciate the spirit that you're bringing into this work and the movement toward getting into earlier and earlier prevention, because we all know that when we go that direction, it not only, of course, is a cost saving, but it's a saving on the burdens that people carry in the different things that they're grappling with. And we are more crisis oriented. So just hearing from you about what's on the horizon, I'm so thankful that you were able to be with us and bring that forward, so that all these people that are doing all of this great work in the northern region get a chance to hear what's going on in the thinking of leadership around what's happening with children and families, and how we can really move our work more upstream. So now I want to open it up for questions. So let's go the same way that we went initially, and that was McKinleyville. You have a question you would like to ask?
Oh, we're unmuted now. May we have one more moment?
Yes, you may have one more moment. Sharon, do you have a question? We'll go to you, Kaya.
Yes, we do. Yes, we do. Oh, oops. Okay, can you hear me now?
Do you unmute?
Yes.
Okay, we would like to know what are the existing counties that are on the front end of this prevention opportunity that we're working together already?
So I don't have a list right in front of me. I would need to dig through my computer here to get it, but I can tell you off the top of my head, Sacramento, San Diego, we have Riverside, Tulare, Ventura, Santa Clara, and I'm sorry, I'm not thinking of the other three, but I can email that to Strategies 2.0 and they can send it to you guys.
Quick question, Angela, were there no rural counties?
There were. I'm not sure exactly who it was at the table. I mean, keep in mind, I don't know many of these people. I'm getting to know them by participating on the cabinet, but sometimes they come and sometimes they don't. The cabinet meets every single month, though, and they've invited other counties to join. I was at Children's Committee last month, and they again pushed and said, you know, if you guys can join this committee, we really want people to be a part of the cabinet. And so this is what we have, and all of them that are on the cabinet, I will say, are very enthusiastic about prevention. But I don't know the list off the top of my head. I would have to look at a previous agenda to make sure that I'm including everyone.
Thank you, Angela. Thank you, Sharon, for the question. McKinleyville, Sandy, have you a question?
Yes, we do have a question, and we submitted it in writing. It is, if the state decides to opt in, to the new federal legislation, will that mean that money may become available to community-based organizations? And will there be a specific focus on Native communities?
So, I mean, I see a tremendous shift right now towards Native communities in particular, where we at the state are we hired a person who is like a liaison to all of the tribes, and we see a real movement here in that realm as well, where we're trying to strengthen our relationship with tribal organizations. Our grants that we are putting out, like most recently we have issued grants for CAPTA around substance-exposed infants or mothers with a history of substance use or mothers that are using substances. If you haven't seen that grant, it was just released a couple of weeks ago. It's in the neighborhood of $400,000 to $600,000 per year. And it's a partnership between community-based organizations and hospitals or healthcare providers. And so that funding, we again make a priority for tribal organizations. And then with regard to FFPSA, I am confident that there will be a priority for tribal organizations, but I'm not really involved in that discussion currently. But I just know that we are moving to really consider tribes much more than we have in the past, and just improve that relationship of the state with the tribal organizations. And I'm sorry,
you, Angela.
I think I missed a portion of that question.
Was there another part to it, Rachel?
We were just
You've answered Lake County's question as well. I noticed on the screen that they popped up that they had a similar question. So we're answering two questions at once. But what was the second part of this
Well, I think
question?
the first part was, is it going to community-based will funding be available for community-based organizations in general?
Will funding be available for community-based organizations? Well, it would have to be available for community-based organizations. Counties would have to come to an agreement with community-based organizations for how are we going to provide services to these at-risk families, for these at imminent risk for entering into the child welfare system. So I would foresee this being much like differential response, in that they would have to have funding going to the community-based organizations and have a referral process that would have to be in place for these families, because keep in mind, these are going to be families that are identified by child welfare, may have a caseworker by child welfare, but the services have to be community-based or services.
Jared Martin has a question. Angela mentioned there may be another definition for families eligible for prevention services. Have there been any conversations about what the other definition might look like?
So, I mean, we're just trying to understand, basically, I don't know what that definition is. I do know that we've gathered numbers, trying to understand like how many people are calling into the line, into the hotlines, across the state, but are not coming into the system. We've been pulling numbers about differential response and those families that are coming into the system potentially as being referred to community-based organizations. But I don't think that we have a clear definition, and I think that that is something that we're going to have to continue to work on in order for us to be able to opt in. And I don't have a definition for you at this point.
Is there a question from this? I think we have great questions. I don't have anything. Okay. No questions here. Did we miss anybody? Was that an online question, Rachel? Okay. Okay. Do we have anybody from Siskiyou that wants to ask a question?
Yes, this is Terry. You had talked about that it didn't support the primary prevention, but it does support the secondary. Can you just define primary to me a little bit more?
The primary prevention, the way we regard it is that they have not come to the attention of child welfare. So anyone in the population that has not come to the attention of child welfare is what we look at as primary. And yet they may have other risk factors and need to be strengthened for various reasons. Secondary is it's the family has been brought to the attention of child welfare. So that means that a report was made. But it doesn't rise to the level of risk that would mean that the child needs to be removed and a substantiation needs to be in place. So secondary prevention are all of those calls that come into the hotline that are means that something may be going on, possibly, but not rising to the level of risk for child welfare to substantiate. And then another piece to secondary are those families that have already been in the child welfare system, have reunified, but there's still risk associated with that child coming back into the system. So that would be another secondary prevention strategy is after reunification to make sure that families are staying together.
Okay, thank you.
You're welcome.
Thank you. I think we've covered all of our remote locations, and we were able to get a participant from online, and we checked out here. So I think we've had a chance, Angela, to kind of give you questions representing all of our locations that are participating today, and I really appreciate your thoughtful responses to the questions and just the whole idea and inspiration for me when I think about it to be going more upstream and to have this be something that so many people in the leadership realm of child welfare are considering and putting time and effort and energy into trying to lead the way here. I appreciate also what you said about kind of connecting over with some of the other agencies, home visitation, kind of, what is coming forward there. All of the grants that are being put out through OCAP and, of course, the support for strategies and, just kind of giving us a glimpse into the future. I really appreciate that. It gives us a little heads up for us to be thinking about, where are we going as organizations, where are we going as a community, what do we really want to see for children and families in our communities, and how can we take advantage of going more upstream. So thank you so much for your time today. And,
Thank you for this learning community.
Just a second, we have one more question that is coming forth. Karen?
It's actually a comment. Hi, Angela. This is Karen Potts. How are you?
Hi, good. How are you?
Good. I just wanted to, on behalf of the first 5 commissions throughout the state and the rural commissions, just want to thank you so much. Your support of family resource centers and your commitment to the vision of importance of fully funded family resource centers is greatly appreciated. So keep, you play such an important part in keeping the FRCs at the center of everything that we do, and it's critical, and your voice is essential. So thanks for all you do on behalf of the Family Resource Center model and prevention model in the communities.
Thank you so much. And I really believe in Family Resource Centers. I believe that you are the support line for prevention. And so, even at this prevention summit, I really want the Family Resource Centers to be present. If your child welfare director doesn't contact you, I would suggest you contact your child welfare director and be at the table, because only about 20 counties are going to be at this summit, but I really think that it's going to be inspiring. We're even going to talk about funding sources. So talk directly with counties about, here's some possibilities of funding sources that you can leverage for prevention. And so this is an important discussion, and you want your child welfare directors, your CAPCs to be present, and don't miss this opportunity.
Thank you once again. I think Angela said it so well. We're in a window of opportunity, and we really want to take advantage of it in every way we can. So thank you for opening that window before us today, Angela. Best to you.
Thank you.
Thank you, Angela. So we're going to take a little 5-minute break here, and we're going to transition so that our next couple speakers have a chance to kind of give you some boots on the ground perspective on the lenses of policy and practice. So go ahead, take a little break, stand up, stretch. We'll call you back in about 5 minutes. go. A nice little break. We're going to now go into kind of a sharing of different practices and also how some of these practices may be leading to policy in our region. And so Wendy, who you see on the screen, had an emergency come up, and she's not going to be able to share with us today, but she has shared about their Shasta Strong Families organization and their collaboration, which has been very successful working here in Redding and in Shasta County. And unfortunately, as I said, she will not be able to join us, but we have Karen Potts here. She's the director of First Five. We have Carla from Lake County, Carla Ritz, who is the director from First Five, and we have Anna Santana, who is the director of Healthy Start in Lake County Office of Education as well. And they're going to just give us some kind of nuggets of what they've been doing. And I want to just go over the screen here so that you'll see what they're going to be talking to us about. So they're going to describe the best practice framework that they are promoting in their organization. And it's very likely to be one of these areas. And they are going to look at two specific best practices. This is an opportunity for, even though you're not all in the same room, networking around some of these best practices within that framework. And one of the practices is going to be within their services and programs, and the other is going to be into the community. And they are going to give an example of how they're working through collaboration to shape policy around resilience in their community. And in that case, they're going to give you a specific best practice that they're promoting among their partnerships and how that practice is shaping policy. And they're going to talk about their main accomplishment, their main barrier, and their approach to sustainability. So just so you get a little bit of the backdrop around what they are going to be talking to you about, and hopefully you'll have a chance to glean some perspectives and insights on how they're doing their work. And of course, as our focus is on prevention today, we've got First Five, a very early prevention or entity in our state, and we're also looking at education, and Anna will talk to us about a trauma guide team that's coming into growing in Lake County. So Karen, thank you so much. The time is yours.
Thank you. I just want to shout out to my colleagues and friends at Siskiyou County, without whom we couldn't do the work that we do, specifically our county partners and the family resource centers. And deep gratitude to Steve for being our tech person out there, so that Terry and others in our communities can be part of this presentation. So I'm Karen Potts, and I'm the First Five Executive Director for First Five Siskiyou Children and Families Commission. And I've had the honor and the pleasure of being part of this community and being the Executive Director for First Five for nearly 15 years. So as Susan shared, one of the things that we'll do today is talk about the two priority areas that First Five focuses on, and again, not in our own internal systems, but also through our collective partnerships with family resource centers, our county partners, and others. Many of you know about First Five Siskiyou Children and Families Commissions. There are First Five commissions in all counties throughout the state. And so what I'm about to share with you is not limited to Siskiyou County. And so we would encourage you to think, if you don't have a partnership currently with your local First Five commission, I encourage you to get to know your executive director, because we truly are the first level of prevention statewide as it relates to children and families. Our internal team, I have the honor and the pleasure to work on daily basis with these amazing women. Cheryl is to the left, who's been with the commission for 20 years, and Paula is next to her. She is our communications and outreach person, and Allison in the center is our evaluation and data support. And Bliss is newest to our team, and she has the job of working on systems building related to home visiting and parenting education. We all know about the protective factors, and I think if you're interested in learning more, because the time is very limited today, if you don't know about the protective factors, I would encourage you to spend as much time as possible on the Center for Study of Social Policy website. There's phenomenal resources, and it will provide you great information about how you can work with your communities to build strong families. And if you are in Siskiyou County and you don't know, we have quite a few. I think we have at least 20 trainers on the protective factors, because last year we collaborated and brought this training to the county. So reach out to us so we can offer this resource to your organization. So today what I will focus on is parental resiliency and knowledge of parenting education. So this is just an overview of First Five's priorities and how they're linked to the protective factors. We'll have this information available if anyone wants to learn more about what we do and our vision and mission. Don't hesitate to contact me, and we can share this information with you. As we think about how to build strong communities, it's critical for all of us to know that no one organization can be the Child Abuse Prevention Council. No one organization can be First Five. No one organization can be the Family Resource Center in our communities. It truly takes collective efforts to prevent child abuse and to really help support individuals, communities, and families. And when we truly work together and think beyond money, it's we not only become a strong community, but we also become a strong beneficiary of the partnerships that we build with a variety of organizations. How do we do this in our counties? These are our many partners that help support the efforts of building resiliency in Siskiyou County. Every single one of these organizations are funding partners and collaborative partners within our parenting education and support. As we all know, budgets are statements of value, and we couldn't do the work that we do without the commitment, long-term commitment of all these variety of organizations, including our county health system, county health and mental health system. Can you go back real quick? Oh, thank you.
Oh,
so
go too far.
Two ways that we really build our collaborative is first and foremost, we have a robust menu of menu of countywide professional development opportunities. These trainings are at no cost to the participants, and they're funded by multiple organizations. So many, as I shared earlier, you can see in this flyer, we had the Strengthening Families 5 Protective Factor training in our county, and these trainings are available to anyone, not just in Siskiyou County, but outside of Siskiyou County. We recently brought Dr. Mendez to Siskiyou thanks to a partnership with our Impact Hub and others locally. And of course, many of you know the president of 0 to 3, Dr. Ross Thompson, who was in our county just in August. So why is professional development important in building resilient communities? And we all know that when we have healthy relationships and strong relationships with our partners who have the common understanding about whatever the topic is, we're more likely to speak the same language, and we're more likely to work together. So how we do this is by offering ongoing, regular professional development opportunities in Siskiyou County through our partners. And I think we have, typically, for instance, Dr. Mendez's training, we were overflowing. We had over 100. The capacity was 60 or 70, I think. We had over 100 participants at that training, and that number continues to increase in our county, in and out around our county. Just in the next 2 weeks, this week we'll offer a training with UC Davis, and then in December we're bringing, many of you know Dr. Peck Endman, who's a PMADS expert, perinatal mood and anxiety disorder expert. We're bringing her to offer a free training in Siskiyou County. Can you help me move? Mm-hmm. I feel like I want to ask if people have questions, but questions are for later, correct? Mm-hmm. Second priority is to offer the support and resources and education that families need to grow healthy children. We know that over 80% of child's time is spent with the families, and we know that regardless of parents' education, parents' background, all parents deserve the opportunity to increase their knowledge about parenting education. Even those of us who have been in the field know that it's kind of like cooking classes, right? You become a better cook when you are taught by somebody else, or when you're facilitated, when you're part of a social group within your peers. It's the same with parenting education. So over the years, we started our parenting collaborative in our county. I wrote the first grant probably about 13 years ago now. And since then, it started initially as a partnership between our Child Abuse Prevention Council and First Five and the Family Resource Centers. And now we have 11 different funding partners that help support the parenting education programming throughout the county. Last year, we offered over 240 parenting education classes, 230 or so parenting education classes. We really believe in the importance of using existing opportunities to grow our collaboratives and to strengthen our and leverage funding. Some of our funding partners are QRIS, Title I Home Visiting Systems, and OPEC. OPEC is a partnership with Ford Family Foundation. So in addition to evidence-based parenting education classes, which include curricula, a menu of curricula from nurturing parenting and also others such as Parenting Now and Make Parenting Pleasure, we have, over the last 2 years, we've made a commitment to increase community education about ACEs. So we along with our partners, offer Movies with a Purpose evening events. All of these programs include childcare and meals, which are critical, right? And they're intentionally planned. This is just one example of a Movies with a Purpose event that was hosted in one of the communities. In addition, on a monthly basis, we have a newsletter that's developed by Oregon State University, who, by the way, are evaluators, who share a Parents Together newsletter that goes out to families throughout the county. In addition to this, we're incredibly targeted in assuring that our programs are implemented with fidelity. Through a collaboration with Oregon State University and Ford Family Foundation, we are committed to assuring that all our facilitators are trained and implement the evidence-based program with fidelity. And this is just one of the examples of the evidence-based programs, of evidence-informed program that includes training and information for the facilitators. So schools are critical partners. So when we think about parenting education, we all know it starts prenatally and continues, in my opinion, for the rest of a person's life. Once a parent, you're always a parent. It's just different roles after they become adults. Our children become adults. So thanks to all of our schools, there's significant number of schools in our county that are eager and interested in partnering with us. And it really is, when I say us, it means for us, it's partnering through our family resource centers. There are feet and hands on the ground. So this is just one example of an event that was hosted at Mount Shasta Elementary School. Thank you, Steve. And then before that, thank you, Bliss. It was a partnership with the school to offer dinner with a principal and an education evening. Since then, there's been multiple parenting classes in this school. I'll hurry. I'm doing something that's not working, right? This is yet another example of workshop that was offered. One of the probably most interesting thing for us and what we're most proud of is we have retired teachers. We have this class was facilitated by Patty Leal, who's a retired MCAH coordinator for our county. We have clinical staff. So there's such commitment to parenting education that we have topic area experts that facilitate all of our parenting classes. This is just one example of what a parenting class was and a number of people that attended parenting class in one of our communities. And I love this quote from a white paper from NEA President Denise Van Rockel, that really parents, families, educators, and communities, there's no partnerships to assure that all students pre-K to high school are supported, in prenatal, I should say, to high school are supported. It really takes all of us working together with the deep understanding that parents are their children's most critical and most important teachers. This is an example in another community. These are actually the children in a movement-based parent-child class that we had in Fort Jones Elementary School. And this is a quote from a parent from a parenting series that was offered in Grenada Elementary. In addition to parenting classes for parents, many of the classes also include educators. One example is a partnership that we had with Butte Valley School District to bring Dina Graves. Some of you may know Dina, a national expert on commercial sexual exploitation of children. When she came to our county, thanks to a collaborative funding stream, the Butte Valley School District required all staff to attend. So at that training, there were staff, parents, community members who benefited from this training. Our latest partnership is with the Siskiyou YMCA. We're delighted that we're part of a collaborative who's increasing the county knowledge about darkness to light training. As some of you know, it's an evidence-based, Darkness to Light is an evidence-based sexual abuse prevention education program. And in our county, there are several partners who are offering these trainings, and we're delighted to be able to expand the program, including offer the first ever training in Spanish. This is just an example of some of the trainings that are offered throughout the county. Finally, lessons learned. What we've learned about the importance of building resilient communities and building protective factors, it's critical for us to really focus on not just programs, but evidence-based strategies. Every family, regardless of whether they live in a large city or in the smallest of towns of Happy Camp or Tule Lake or McLeod or somewhere in between, deserve evidence-based programming, and it's all of our responsibility to work together to assure and lift up those programs, because families deserve that. Shared leadership, engaging all partners, and what I would say with that is engage all partners that are willing to work together. What I notice is oftentimes we tend to put our focus on the things that are not working, and what we've learned over the years is we work with those that want to truly work together for the greater good. Finally, never give up, and know that the investments of kindness, dedication, and support to the people around you really reflects on the work that we do as community partners. Thank you for the opportunity.
Thank you, Karen. Thank you, Karen, very much. So we'll just move on to Lake County and hear from Carla and Anna. And I think in a little nugget, what we can hear from Karen is that parent education is really a very powerful best practice in Siskiyou County. It's being done in many different ways, and you've got a host of partners that really support this effort, and that it's really become a policy. Lifting up your community, prevention, starting very early, and bringing the partnerships together, so that you're going to continue this thread of parent education in all of these different venues. And by doing so, that's actually going to change your system, your service system.
Right.
And in the long term is also going to change the way that parent-child relationships.
Absolutely. And really, I think the only thing that I would add is oftentimes we tend to think either or, and really parenting education is a continuum. It starts from home-based, one-on-one parenting education and moves all the way to parent workshops, parenting evidence-based series, but also social connection, parent-child activity, family fun events. So all of those are part of one. So as we think about investment, it's critical for us to not say, oh, we have home visiting, therefore we shouldn't fund family resource centers or parenting or any. We really should find opportunities to utilize existing resources to expand and grow collective parent support programs.
Yeah.
So
that's a good point too, that bringing up the fact that last learning community, we talked about social connections and the value of them. Mm-hmm. And so when you bring parents together, you're automatically creating an opportunity for social connections to transpire. So beautiful way that you're moving forward the protective factor framework in your commission.
Thank you.
So thank you.
Thank you.
So now we'll go to Carla, and I think Carla is going to talk to us a little bit about protective factors as well, and then Anna will talk to us about the trauma guide team that's developing in Lake County, and I'm just going to turn the time over to them so that they can give you a flavor of kind of maybe how different counties are looking through the lens of the protective factor framework in First Five, and then also kind of how the trauma guide team came into existence and where it is and how it's forming. So thank you so much. Carla.
All right. Can you hear us here in Lake County?
Yeah, I hear you.
Hooray! Fantastic. It's too bad you can't see us because we look phenomenal. I just want you to know, I'm looking around the room and you've never seen a finer group, but we are very glad that we are not on the webcam. So Anna and I don't have to suck our gut in. We can just let it out. We can just tell you how things are and be very relaxed. I'm Carla. I'm the director for First Five here in Lake County. Unlike wonderful Karen, who's such a great mentor and encourager over in Siskiyou, I've only been on the job here a little less than 2 years. So I'm still learning and growing, and I find myself in a county that works together really well and that knows how to partner, and it makes my job a lot of fun and a lot more effective. So thank you for asking me to share. Resiliency is a great word, and I'm glad we're talking more about resiliency and less about trauma, although we need to talk about both. And so when I think about a best practice framework that we use to promote resiliency through First Five, it is definitely the protective factors. So strengthening families' protective factors, just like Karen talked about, is our chosen framework for First Five Lake County. It has been in the past, and we're only going to strengthen that connection going forward. We just met, we're planning our next 5 years right now. And the start of that was to gather our partners together and talk about what's our vision. You know, the babies that are born next year, where do we want to see them in 5 years? And we looked at pictures of babies and we looked at pictures of 5-year-olds, and we thought about what's it going to take to get them from point A to point B. And it's going to take a lot of resilience on the part of their families. And so the protective factors was the framework we decided was the best suited to the vision elements that our community told us were important. And just so you know, that group was awesome. They came together for a full day. It was foster parents, grandparents, community partners from social services, public health, the County Office of Education, Family Resource Center, school districts, Sutter Lakeside Hospital, Redwood Community Services, Easter Seals, Health Leadership Network, our tribal community, Motherwise, which is a postpartum depression prevention program, and our libraries all came together and talked about our county together. And the vision elements that they are putting forward for First Five for the next 5 years are earliest possible connection to resources. So every family that has a baby in the county, we want them to know about every resource available to them right away, like before they even get to the hospital. And then for families moving into our county, we want to connect them as quickly as possible. They told us that we want that our kids need to have their basic needs met, that there has to be a user-friendly service delivery system, and that we have to have access to comprehensive health care for our kids' mind and body, and access to quality early education. And the protective factors framework is really it makes complete sense to help us get there. So that's what we're using. And the way we're going to use that framework is that every decision that we make as a commission, as the First Five Commission, it's going to reflect, we're going to reflect on the impact that decision is going to have on our families. We're going to think about how will this affect their concrete supports in time of need. Is this going to make it easier for them or harder for them? We're going to talk about their knowledge of parenting and child development. Are we moving in the right direction? There's children's social and emotional security, parenting, resilience, and social connections. All those protective factors we're going to reflect on regularly with each of our programs. And then the programs that we fund or support or partner with are going to include the protective factors in their scope of work. So the song that comes to mind, it's not very classy, but the song that comes to mind, and I don't know the whole thing, is "If you want to be my lover, you got to get with my friends." Spice Girls. So the whole idea of, you know, as a partner, you get to say, like, these are, if you want to hang with us, like, this is what you got to do. And so that's kind of what First Five is saying, is like, if you want to hang with us, protective factors, you got to get on board. And you can't just say you're on board. You have to really think about it, and you got to tell us how you're going to measure that. How are you going to show that the parents you work with have concrete support, more concrete support than they did when they started working with you? How are you going to show that they have better parenting skills? So we're asking our partners to think about that too. And that's sort of a prerequisite for partnering with us. And we listen to their prerequisites and jump on board too. The second question was featuring 2 best practices from the framework that we find to be really effective. So of the different protective factors, social and emotional security of children is a big one for us. So 0 to 5, we know is huge for brain development. And brain development isn't just about learning your ABCs, it's about learning how to cope with life. And research shows that self-regulation is a better indicator of academic success than IQ or entry-level reading or math skills. So I'll say that again. Self-regulation is a better indicator of academic success than IQ or entry-level reading or math skills. So First 5 Lake is funding programs in the community that try to help increase children's social skills. And some of those programs are nurturing parenting, just like Siskiyou is doing. Nurturing parenting education is helping parents understand how to develop social skills for their kids, how to help them self-regulate, how to self-regulate themselves. So we all need more help with that. So their home life is better and so that children feel safe. AmeriCorps members in our county, we're funding positions for AmeriCorps members to be embedded in preschools to teach the second step curriculum. Second step is an social emotional development curriculum. And it helps children to learn to take turns and ways to calm down and how to name and manage their emotions, all of those sorts of things. And then those members are also reaching out to the parents to help them incorporate the same things. So that's a big one for us. And the other one, other than social and emotional, is that social connection and knowledge of parenting and child development. Those go hand in hand for us. So one way we are doing that here is through early learning centers in our community. These are free playrooms for parents and caregivers to bring their kids, and they're cell phone free zones. So they have to interact with children. And we also frequently have AmeriCorps members who drop by there and teach those same social emotional skills to the parents who are playing very organically and casually. Meanwhile, those parents are getting to know each other and they're learning from each other and those social connections are being built. And the knowledge of parenting and child development, one thing First 5 is doing is bringing the brain architecture game to the community. So we are providing that. It's a game that's produced by the Harvard Center for the Developing Child to teach about how a child's brain develops and what negative things impact that and what positive things enhance that. And it's a very, anytime you do something hands-on, you learn more, right? Anytime you participate, you're going to learn that lesson and it's going to stick with you more. And so that's the whole idea. And that's why First 5 is investing in that, is to help that lesson stick in our community and to help our whole community understand what goes into child's development. An example of working collaboratively through partnerships to shape policy. Honestly, it's that leverage that we bring to the table with protective factors and asking all of our partners to get on board with it. That changes policy because then they have to incorporate it into their scope of work, and it becomes something that their organization now embraces as well. So it just spreads. It's like a virus, a good virus, a really, really good virus of protection. I would just say lastly, at the last learning community, one of the things that I took away from the guest speaker, whose name I can't remember now, sorry, Susan, he was from Orange County. Anyway, he talked about the Resilience donut. He mentioned it very casually, and I thought, oh, I love that. I love donuts, first of all. I just got back from Portland. Voodoo Donuts, you have to go. It's very good. But anyway, that got my attention, and the Resilience donut, I looked it up, and it's an Australian entity, research-based, that is giving us ways to incorporate resilience with families, with both children, with teens, and with adults. And it's making it very concrete, and they have all sorts of resources. So the donut idea is that the center of that donut is what we believe about ourselves. Who am I? Who can I count on? What am I capable of? And then there you have 7 sort of realms on the outside where the chocolate goes on the donut, or maple, equal opportunity. And those are the things that are the external factors in a person's life, and that lend themselves to resilience or drag people down. So it's your partner, it's your skills, it's your family identity, your education, your friends, your community, your work. If it's an adult, the children, so it's a little different. But it kind of goes into each of those and helps people for themselves and find their strengths. And they found that you only need 3. I mean, it really kind of frees people up to see, you know what, I really am resilient. I don't have to have everything going for me to keep going. I just need a few things. And then he said his quote at the last learning community was, resilience is not how you endure, it's how you recharge. And so I felt like that resilience donut idea and all of the resources they have are really, they could be really potentially a great way for us to bring that idea to Lake County in a tangible way to help people see how to recharge instead of focusing on how just hanging on, constantly hanging on. It's having seasons of refreshment and recharging and getting back at it and knowing where you can find that and where not to waste your time. So that's an exciting thing that's coming up. And I'm going to stop there because Anna's here and she's the star of the show.
I'm not answering those questions.
You do your own thing.
So I'm Anna Santana, and I'm relatively new to my position as program director because I was frontline staff. I was case manager doing differential response with our families here in Lake County for many, many, many years. So I got to see the ins and outs of how families navigate or not navigate in their lives here in our county. But 2 years ago, when I did become program director, and shortly after a presentation by Gabriella Grant here in our county in June of 2016, she helped us, she prompted us to begin thinking about how we could mobilize for action and work collaboratively around some common practices to reduce the trauma exposure in our community. And at that presentation, all the attendees, you know, we were all charged up because Gabriella Grant is an amazing speaker. We've had her back various times, and she motivated a lot of us who signed up. Involved us in tasks, you know, in the task. And the good thing is that people wrote on a flip chart their name in their own handwriting with their own pen. So it was really easy to track them down and say, hey, you signed up for this, so guess what? So at our Children's Council meeting, we agendized, you know, we signed up, so how are we going to do this? And so began the journey of the trauma guide team here in Lake County. And we had representatives sign up for this subcommittee or guide team under the Children's Council, which is our CVCAP, under our umbrella, representing all of the organizations that work with families in our county, including LCOE Healthy Start, Lake Family Resource Center, First Five Lake, Lake County Child Welfare, Lake County Probation, Redwood Community Services, Easter Seals, North Coast Opportunities, Lake County Public Health, Lake County Behavioral Health, the State Council on Developmental Disabilities, CASA Medocino Lake, Health Leadership Network, ACES Connection Network, and some of our tribes and tribal health. So our Big Valley Band of Como Indians, Scotch Valley Band of Como Indians, Robinson Rancheria, Habimato, Como of Upper Lake. So we're all at the table, and we say, you know, our focus is going to be prevention of child abuse and neglect. And because our Children's Council is coordinated through Lake County Office of Education, that just was a natural pathway for our school districts then to get involved. So our trauma guide team just kept meeting and talking about things and making you know, discoveries as we went along. And we are now known as Growing Resilient Lake County. And we're still in our early stages of formation, but step one was to get all of the participating agencies to use a common language and to have training on best practices. You know, in strategies has been really vital to this. They've brought several trainings to our community, to our county, and we've been able to invite our partners. We've worked collaboratively with Lake Family Resource Center for many years, and Tribal Health. Getting people to trainings is really important. As Karen said, we speak the same language. When we're working with the same families, we have a lot of crossover with families that we work with through our child welfare system, through our Department of Social Service system, through our probationary system. So it's really important that we speak the same language. Strategies is helping to do this by providing training in our protective factors, trauma-informed care, and ACEs coming up really soon. We've already had our a good training with our pair of ACEs, which was very fabulous, facilitated by Troy Nichols and Lucy Hernandez. It was awesome. We'll be coming up soon with our trauma-informed training as well. In February in 2018, we brought Kelly Rizzi over from Shasta County, and she did a trauma-informed care in-service training for many of our teachers. We had 81 educators from the various districts in Lake County, as well as from some from Mendocino County. And then on July 27th, we brought her back again, and we had an additional 60 educators. Kelseyville Unified School, Konocti Unified School, Lakeport Unified School, and Upper Lake Unified School have all had some ACEs training. And recently, Kelseyville Unified had a trauma-informed training, as well as a cultural sensitivity training for all of their classified and their certificated staff on August 27th. That includes bus drivers, cafeteria workers, custodians, teachers, principals, coaches. Everybody was there, and it was pretty amazing. Some of the other agencies that had the trauma-informed training with Kelly Rizzi, sorry, I'm all over the board here, were Healthy Start, were the Head Starts, Lake Family Resource Center, Lake County Tribal Health, Adventist Clear Lake, Lake County Hospice, North Coast Opportunities, Probation, Lake County Sheriff's Office, Lake County Office of Education, and Lake County Behavioral Health, as well as First Five. So the next step in developing an action plan, the partners will use to work together on common goals. This will shape some of our priorities and policy moving forward. And although there is still much to be developed, this is a major stride forward in organizing cross-sector collaboration in how we're addressing trauma and resiliency in our community. That's all I have.
Start over.
Oh, okay. I think we just got off of mute. So thank you so much for your wonderful presentation and inspiring about what you're doing. And we're going to wrap up with an opportunity for networking. I want to leave the current slide on the screen so that if you want to follow up with any of these presenters, you're certainly welcome to do so. Their emails are there, but I just want to kind of summarize what we've been looking at today before we go into the networking opportunity. We've been networking all day, but for us to actually be able to share some ideas in each one of the sites and then bring those forward to the bigger group. I think Angela really opened up a vista for us and challenged us to think about how we might bring more prevention into our work and looking at the current frameworks that we use in our work, whatever that might be. Certainly you've been hearing that the protective factors are a common framework. People have used trauma-informed care, of course, as a lens in which they're doing their work. And so she really presented a moment of time where you can see what it takes to go through a policy, that they're having to have a lot of conversations about this. They're having to, bring groups together to have conversation about it. They've got leadership together that's talking about it. And so this isn't something that happens overnight, and I think they're inviting our input. And there's going to be a summit that's coming up, and again, the value of teamwork, to attend the summit in teams. And so thinking about all of this in terms of opportunities that may be available for your community as you're kind of thinking ahead to how you might be able to turn the spotlight a little bit more on prevention. That doesn't mean to stop doing any of the work that's being done, but to think about how that prevention piece gets added in a meaningful way. And then I think what the presenters have had to offer in terms of looking at, some of the practical ways that you might look at practices and policy. I think you've heard that all of them are really looking at who's at the table and who needs to be at the table in terms of being able to increase the impact and scale of the work. No single organization is able to really make the level of impact that's needed to decrease that population attributable risk slide that we saw earlier around all of those different things that are possible if we were able to really start to mitigate and erase some of these issues that we're talking about and working with in the family strengthening realm. And so I think the partnership is very significant. And then people talked a lot about professional development. And when you're thinking about your own communities, are there opportunities for professional development? What might that look like? Certainly parent education has been brought out as a key action that people are taking in different ways, in different communities. Whether it might be a movie night, whether it's subject matter experts that you're bringing into your community, whether you're creating social connections around bringing parents together so that they can talk with each other, learn from each other, and learn from a curriculum or whatever it is that you're presenting. How you began to put policy into place, as Carla was mentioning in First Five, they're going through an RFP process. They're going to be making contracts. How do you put something that you're trying to promote into that realm so that as people are partnering together, they're also responding to that framework and they're being able to demonstrate how this is happening. What do we do in our work to move forward this particular framework, whatever that may be as a best practice that you are implementing. And then Anna talked to us about how a presentation, and Carla did too, and hopefully today's presentation started to spark some thoughts for you. Carla talked about the resiliency donut and how hearing that kind of led her to do a little bit more investigation around that and to learn more about it and how she might be able to move that forward. Anna talked about Gabby Grant and hearing from Gabby. And Karen also talked to us about, how they have brought subject matter experts into their community and how that has sparked thought and how that has shaped the things that they're doing and the priorities that they are making. And so these are things that, we're hoping will trigger some thought for you about what could you take from today and how might you move that forward in your organization, and how might you think about that in the broader community? How could you invite partners? Do you sit on any kind of collaborative councils or in any kind of collaboration where you might have an opportunity to plant a seed. And what would that seed be? And how might you move that through that collaboration so that it starts looking at practice and policy? So I'm going to leave it there, and I'm going to change the slide so that you can all take a look at what the questions are that we're going to wrap up with today. One learning from today that would benefit your organization, how you would promote that in your organization's practice or policy, and how would you invite others outside your organization to participate in this action. So this is probably something that you can quickly chat about. I'm sure things will be right there at the top of your, thoughts. And so we're going to give about 15 minutes for you to think about this together in your locations. Those of you that are online, thinking about it, maybe you have somebody in the room with you, but thinking about it in terms of, what would this mean for your organization? And, what does this open up in terms of thinking about policy and practice? So after 15 minutes, I'll call you back together again, and then we'll record. We'll report out, and we'll record. And again, the person that has been facilitating in your group will summarize what you've talked about so that we can just get the learning, get how you will promote it, and then how you might invite others to participate. So we'll talk again in 15 minutes. Thank you. Okay, welcome back. We had an interesting conversation here, and so I'll just launch into it to give you kind of an example of what we're looking for, report out from each one of the locations. So in our group, the learning from today, there might have been a couple that kind of were squeezed together. We launched into the conversation actually around the issue of self-regulation and the difficulty of children learning how to do that when they may be in a family that is not very well regulated itself. And we just, from there, went into a learning from today, getting more involved with the community, promoting subject matter experts, people with expertise, involving them in what it is that we're trying to do, and educating professionals on best practice. And how would you promote this action within your practices or policies? And it would really be education, again, moving that up as a value in terms of how we infuse the work with expertise. And that might come from a curricula, that might come from a subject matter expert, that might come from, somebody who is very good working with children, somebody who's very good working with adults, using those people to be able to infuse that practice within the organization. And then how might you invite others outside your organization to participate in this? So this was where it was mentioned in the very beginning that, and then in the experts that we had from our little nuggets of practical implementation, that things like family festivals, things like socials, ice cream social came up in our discussion, developing a strengthening families collaboration, or whatever you might want to call it. We heard that it's called the Trauma Guide Team in Lake County, but developing an opportunity for collaboration and bringing in others, whether that would be other organizations or whether that might also include bringing in families and parents to be more involved in the work. So that was what we chatted about in our little group. So let's move to McKinleyville. I'm just going to try to go the order that we've been going in for the day, if McKinleyville is ready. Sandy?
You're muted, Sandy.
Sandy? Sandy muted? Okay.
Sandy, you're self-muted, so I don't know if you were talking.
Well, one of the things you all get to see is what it's like to try to operate the technology around this.
Well, I thought I had unmuted it.
There we go.
Okay, so we took a bit different tack. Rather than more formalized parental education, we talked about, promoting social connections and how to get information out to those groups versus, going to the school or, like I said, doing formal parental education. The second and third questions are kind of answered in one program that we have here. It's called Love Your Neighborhood, where our coordinator goes out to identified neighborhoods, and she promotes, she does mom groups and girl empowerment groups, and she works to get that neighborhood to collaborate and connect with one another. And so as far as how she might invite others into that, it's a natural byproduct of what she's doing.
That sounds great. I really like that. Love Your Neighborhood.
It's really great.
Yeah.
So it's just a little different approach than formalized education. But I think that's it for us.
Okay, thank you. Thank you very much. I will summarize this and send it out to everyone afterwards. Okay, Ukiah. Sharon?
Oh, don't unmute me on the computer. I'm on a telephone. The learning opportunities through Angela's presentation about the prevention collaboration. So we've already made contact with our local child welfare in order to move forward on that prevention team so that we can participate. We also talked about collaborating more on a regional basis between Lake and Mendocino County in supporting opportunities in the middle, especially for our younger kids in our trauma-informed schools, taking on some of the efforts that Lake is already doing, but moving more towards a regional opportunity in delivering services to our family. And then how might we invite others to participate in this action? They're getting added to a listserv.
Anything more, Sharon?
No, that's it.
Okay, thank you. Lake County?
So we took several things back. First, of course, prevention strategies for our organization. Some think back to productive factors. Movies with a purpose was pretty important and pretty popular. Advertisement is vital. Foster kids and the at-risk community is should be a main focus, and collaboration is very important. Collaborating with partners for advertisement, and not just saying we collaborate, but really collaborate. Work together in advertising what we're offering. An important thing to inviting more people onto our work is personal connections, such as branching out into businesses or to parents, to active parents or parents who have concerns to join, and just advertise more and advertise together. And the concept that was brought was to invest more money in staff and be more proactive than reactive.
Okay. That sounds great. Great ideas. Siskiyou, Steve.
Hi there. So one of the identify the learning today would be the lift, link, and leverage. We really find that to be very important in the work that ongoing work we're doing in Siskiyou County. We promote that action within our organization by training and modeling and working with our clients, especially with the strengthening families framework. We really apply those to that. We invite others outside of our organization. We like in Dunsmuir, we host a community care team, and we work with local leaders, different churches, the schools. We all collaborate together and address issues like food insecurity. And we actually have an upcoming event next week where we're going to be doing a turkey distribution for Thanksgiving, but we're working with GNS and the high school. We're working with the elementary school and the county. We have SNAP Ed and CalFresh coming to do presentations. So we really emphasize in all of our work to collaborate as much as possible and not to duplicate work that's already going on in the county.
Very good point.
Can I add to that, Susan, if it's okay?
Sure.
I wanted to just share that, again, you know, in the communities where we have family resource centers or as those community hubs, there's coordinated systems, you know, that every organization puts a little bit, but there's a place where parents can come in, you know, at least 25 hours a week for social connections, for volunteering, right, Steve? For remodeling buildings if they need to, you know, just as a way to come together for not just to strengthen their parent connections, but also to give back to their community.
Yes, but that's a great point, Karen. Sorry, Karen, I didn't mean to cut you off.
Okay, so it looks like there are things, online. Did anybody share anything online? Okay, I think we covered the basis then. So we can see that more opportunities for social connection, more opportunities for prevention collaboration, more opportunities for how we might think about working with foster kids, opportunities to think about advertising and promotion, the lift, link, and leverage language that Angela offered, which I think that's kind of catchy and it does kind of stay with you. How you might promote this action, socials, family festivals, getting a commonly held curriculum with subject matter experts, the Love Your Neighborhood concept where you're making a lot of connections through different group offerings that are available, kind of not in the formal education, but more informal connections. Participate in OCAP's efforts. Collaborate to advertise and promote efforts, truly collaborate where people are sharing resources. And then training, modeling, strengthening families, networking. And then how do we invite others, again, providing things for the community to be involved, whether it's a social, whether it's Love Your Neighborhood, moving into more regional work, perhaps Mendo Lake doing more stuff together, especially around the trauma-informed school concept, reaching out to businesses and how they might be involved in the work we're doing, and specifically here around advertising and promotion, and being more proactive rather than reactive, and working with local leaders, churches, schools, really expanding the reach of who may be in our collaboration. And I really like the notion, I think we're all thinking this way, we need to utilize our resources so that we are not duplicating and that we are expanding and extending and building off of our resources as much as possible. And the idea of inviting parents to be back involved in what it is that we're offering. And it may not only be parents, but where are there opportunities for reciprocity and for volunteering and for really participating in building up our communities together. So I think these are just great ideas that have come to light here. I know that you're all doing phenomenal work in your own community, and we're coming up on our closing time for today. I just wanted to announce that our next learning community will be on February 21st, and we'll be looking at innovation, and we'll be looking at data sharing And I think all of you are kind of aiming for collective impact in your communities, and shared data is an element of collective impact. And so we'll be looking at that as well as some other innovations. So mark your calendar for February 21. And as we continue building out, we had a lot of moving parts today with these different remote sites and bringing Angela in by Skype. And I really do appreciate Rachel, who is working the equipment, and Troy, who helps her out with that, and Michael, who chimes in as well. I'm not techie at all, as probably many of you can tell, but I really appreciate the support that comes from them and their expertise. And I think that's what we've been talking about in one way or another, is bring our expertise together, bring our contributions together, collaborate, work as a team, and make a difference in our communities. So we'll see you again on February 21st. Remember to fill out your evaluation forms. And the evaluation forms get scanned and emailed back to Lana and to myself. And for those of you that are facilitating, you have Lana's email as well as mine, so that you can send the sign-in sheets and the evaluation forms back to us, because that's part of the evaluation. It's part of how we're keeping records. So,
I have a comment.
You have a comment?
When you're done, yeah.
Yes, Rachel has a comment.
So, as you can see on the screen, we have a webinar coming up later this month. Please sign up if you're interested, strategiesca.org. And just in general, we have webinars all the time. So we appreciate you participating in our learning communities, and you can go to strategiesca.org to check out trainings and webinars.
Thank you, Rachel, and thank you again, everyone, for your participation today and for helping us, because Strategies is experimenting with this method of trying to bring people together from across a region and actually across a state, and by technology, being able to connect us in a way that we can share our thoughts, we can continue to move forward this theme of resiliency, and we can benefit from what each other is doing. And I would be very remiss if I did not wish you a very happy Thanksgiving holiday, and we won't see you again until February. So Merry Christmas, Happy Holidays as well. Thank you very much for your participation today. Thank you, Susan.
Thank you.
Bye.
Bye, everyone.